we look into the dissection of the blood supply of the heart. As you all know, the heart is supplied by the two coronary arteries, the left coronary artery and the right coronary artery, and these are actually not the end arteries, but they behave as end arteries, and they are considered as a vasa vasorum coming from the aorta. So vasa vasorum is nothing but a blood supply which is supplying an other blood vessel. Okay, so here in this heart, what you are looking at here, this is a pulmonary trunk, this is a pulmonary trunk, this is a aorta, this is a superior vena cava entering the right atrium. Okay, so if you look at the aorta, you can see the three sinuses, the dilatation of these three cusps, what you are seeing there, dilatations, what we are seeing, calling them as aortic sinuses. Okay, and they are approximating each other, so that's why they are having this triradiate appearance. Okay, even here, just like the pulmonary orifice, okay, the free margin in the center, it is having a bulging which we are calling it as a nodule. On either side, we are calling the thin laminae as lunule. This is known as nodule and these are known as the lunules, and this is known as a aortic sinus. Okay, so here we are having three aortic sinus. This is known as the anterior aortic sinus or the right anterior aortic sinus. This is known as right posterior aortic sinus, and this is known as left aortic sinus. Okay, so this right anterior aortic sinus, from this we have the origin of this right coronary artery. So this one what you are seeing here, this is a right coronary artery. I try to show you the opening. Okay, so that is the opening which we are calling them as coronary ostium. Okay, from which we can see the origin of this right coronary artery. In the same way, from the left side, the left aortic sinus, we have the origin of left coronary artery. So this is a left coronary artery, and you can see the opening here. I hope you are able to see. So that is the opening there into the left coronary. Okay, so we will discuss in detail about the course and the branches of the right and the left coronary artery. Okay, so what we are seeing here, this is a right coronary artery. What you can see, it is traveling in this atrioventricular groove, then it winds around the inferior border of this heart and it's going to the inferior surface, and finally it gives the branches. Okay, so from the origin till this inferior border, we are calling this as first segment, and the other part we are calling it as a second segment. So what are the branches which are arising from this first segment? Okay, so the branches, what you can see is towards the ventricle will have all this ventricular branches. All these branches what you are seeing, these are all the ventricular branches going and supplying the ventricle, and above we will be having the atrial branches. Okay, so these are all the atrial branches which will come and supply the atrium. Okay, so first we will discuss about the ventricular branch. So the first ventricular branch is known as a right conus artery. This is known as right conus artery. So it goes along the infundibulum of the pulmonary trunk. You can see the artery is going along the infundibulum of the pulmonary trunk. Okay, and it is going to go and anastomose with a similar artery which is coming from the left coronary artery, which is known as left conus artery. So right conus artery and the left conus artery together, they are going to anastomose to form a necklace around this infundibulum, which we call it as annulus of Vuissens. Okay, so this is forming this annulus of Vuissens. Okay, so usually it is going to be the ventricular branch coming from this right coronary artery, but sometimes what happens is it arises directly from the aortic sinus, then we are calling that as a third coronary artery. So I will try to show another specimen where it is arising directly from the. So here we can see this is also the right coronary artery, and here we can see this right conus artery is arising directly from this aortic sinus. So here we are having this aortic sinus. So we can call this as a third coronary artery. So the right conus artery arising directly from the aortic sinus, then we are calling that as a third coronary artery. Okay. So these are the main ventricular branches what you can see. If we come to the atrial branch, so one of the atrial branch, you can see it is going posteriorly backwards between the root of the aorta and the right atrium. So this is known as a SA nodal artery. Okay, mostly arising from the right coronary artery. This is the SA nodal artery which goes behind and it's going to supply the SA node. Okay, so these are the main branches coming from this first segment. So if you look at the second segment, so second segment is present in this posterior atrioventricular groove and finally at the crest of the heart. So crest is the point where the posterior interventricular groove is joining with this atrioventricular groove. That point we are calling that as a crest. Okay, so at the crest of the heart, this right coronary artery is going to give this posterior interventricular artery. So this is present in the interventricular groove, so we are calling this as a posterior interventricular artery. The remaining artery is going to go and it's going to anastomose with this left coronary artery. Then what are the branches coming from this posterior interventricular artery? So mostly you can see on either side it's only the ventricle, so it's going to give the ventricular branches on either side, and below we are having the septum, interventricular septum. So it is going to give septal branches, okay, which is going to supply 1/3 of the septum, the posterior part of the 1/3 of the septum, as well as first branch, the first septal branch coming from the posterior interventricular artery is considered as a AV nodal artery, which goes behind, which winds around, goes above and is going to supply the AV node. Okay. And what is meant by coronary dominance? Okay, the artery which gives rise to this posterior interventricular artery. If the right coronary artery is giving, then we are calling that as right dominance. But if the left coronary is giving, then it is known as left dominance. So usually in 70%, 70 to 80%, it is the right coronary artery which gives. So it is a right dominance. Only it is 10 to 20% we can see the left dominance. Okay, so that is about the right coronary artery. Now coming to the left coronary artery. So left coronary artery, we have seen the origin. It is originating from this left aortic sinus. Okay, so you can see it is traveling behind the pulmonary trunk, then it comes to the front. It is lying between the left auricle and the pulmonary trunk, and here it is dividing into branches. Okay, the main two branches what you will see is a anterior interventricular artery, because it is traveling in this anterior interventricular groove. So this is known as anterior interventricular artery. The other one is a circumflex. This branch is known as circumflex, which winds around in this atrioventricular groove. Okay, so first we look into the branches of this anterior interventricular artery. So this anterior ventricular artery, it travels in this anterior interventricular groove, and finally it winds around this incisura epicis cordis. It goes behind and it anastomoses with this posterior interventricular artery. Then what are the branches arising from this anterior interventricular artery? Mainly you can see on either side it is a ventricles, so it is giving the ventricular branches, and we said here it is going to join with this right conus. So the left conus artery is going to come and is going to anastomose with this to form this annulus of Usens. Okay, just at the origin we are having this artery which we call it as a diagonal artery. Okay, so this artery is a diagonal artery. So mainly it gives a ventricular branch, it gives the left conus, it is also giving the diagonal artery. Now coming to this circumflex branch, you can see the circumflex branch, it is winding around within this atrioventricular groove, and finally it goes and anastomoses with this right coronary artery. And the branches what you can see here is mainly it gives the ventricular branch, it gives the atrial branch which is going to come and supply the atrium, and it's also going to give this left marginal artery. It goes along the margin, so we're calling this as a left marginal. If it is a left dominance heart, then even the posterior interventricular artery is also going to come from this circumflex branch. Okay, there are always many variations within the coronary artery blood supply. So usually the branches which come from the circumflex, they are this left marginal artery as well as the ventricular branches and the atrial branches. But in 10 to 20% individuals, even the posterior interventricular artery also arises from this circumflex branch. Okay, so that is about the supply of this left coronary artery. Now coming to the venous drainage. So anytime if we saying blood supply, we have to consider both the arterial supply as well as the venous supply. So now we will discuss about the venous supply. So as you know, 60% of the heart venous blood is drained through this coronary sinus. So what you're seeing here in the posterior atrioventricular groove is a coronary sinus which opens into this right atrium through this coronary sinus opening, which we have seen in the interior of the right atrium. Okay, so 60% is drained by this coronary sinus, remaining 20% is directly drained into the right atrium. So what are the veins which are directly draining into the right atrium are, so one is vena cordis minimi or the Thibetian valves which are opening on this foraminae venarum minimarum. Okay, the other one is the anterior cardinal veins. These two directly drain into the right atrium, and 60% is drained through this coronary sinus. Okay, so this is a sinus which is about 2 to 3 centimeters lying within this left to the posterior atrioventricular groove. Then what are the tributaries which are draining into this coronary sinus? So within this anterior interventricular groove we are having this great cardiac vein. So this is known as a great cardiac vein. So this great cardiac vein is joining with this left marginal vein. So both of them, they are joining to form this coronary sinus. So anterior interventricular groove we are having the great cardiac vein, the left marginal, both are joining to form this coronary sinus. And the other branches what we can see in the coronary sinus is, here we have this middle cardiac vein. Posterior interventricular groove we are having the middle cardiac vein which is also coming and draining into this coronary sinus. The other vein what we can see here, this is known as posterior vein of left ventricle. This is the posterior vein of left ventricle which is also draining into this coronary sinus. From the right side, first we have the right marginal, it will be joining a small cardiac vein, it will come and drain into this coronary sinus. So this vein we are unable to see, but here we will be having a, in the atrioventricular groove we will be having a small cardiac vein. Okay, so all this will be draining into the coronary sinus, and coronary sinus will finally drain into the right atrium. So anterior interventricular groove we have the great cardiac vein, posterior interventricular groove we have the middle cardiac vein, and atrioventricular groove we are having a small cardiac vein. All this will be draining into this coronary sinus, and that will be draining into the right atrium. Okay, so that is about the blood supply of the heart.